Hello and welcome. Today we're diving into a rare and complex condition called a vesicorectal fistula. This occurs when an abnormal connection forms between the urinary bladder and the rectum. While uncommon, understanding the causes, symptoms, and treatment options is crucial for effective management and improved quality of life for those affected. Let's explore this condition in detail. So, what leads to the development of a vesicorectal fistula? Several factors can contribute. One of the most common causes is diverticulitis, an inflammation of pouches in the colon that, if severe, can erode into the bladder. Another significant cause is colorectal cancer, particularly when tumors invade surrounding tissues. Radiation therapy to the pelvic region, often used to treat these cancers, can also damage tissue and create a fistula. Surgical complications, such as after rectal or bladder surgery, represent another potential cause. Less common causes include inflammatory bowel diseases like Crohn's disease, traumatic injuries to the pelvis, and rarely, congenital abnormalities. Now, let's discuss the pathophysiology or how this condition affects the body. Normally, the bladder and rectum are separate, functioning independently. In a vesicorectal fistula, this barrier breaks down. Urine, which is usually sterile, leaks into the rectum, and fecal matter can enter the bladder. This abnormal communication leads to a mixture of urinary and fecal contents, resulting in a variety of distressing symptoms. The constant exposure of the bladder to fecal bacteria can lead to recurrent urinary tract infections and inflammation. The irritation and inflammation can also affect surrounding tissues and organs. Vesicorectal fistulas are relatively rare, making it challenging to pinpoint exact epidemiological data. However, we know that they are more commonly seen in adults, particularly those with a history of diverticulitis, colorectal cancer, or pelvic radiation. Men are slightly more likely to develop vesicorectal fistulas compared to women. The overall incidence is low, but certain predisposing conditions significantly increase the risk. Further research is needed to gather more precise epidemiological information. The signs and symptoms of a vesicorectal fistula can be quite disruptive to daily life. A hallmark symptom is pneumaturia, which is the passage of gas in the urine. Fecaluria, or the presence of fecal matter in the urine, is another key indicator. Patients may also experience recurrent urinary tract infections, often resistant to standard antibiotic treatments. Pain in the lower abdomen or pelvis is common, as is dysuria or painful urination. Diarrhea, constipation, and rectal bleeding may also occur. The severity and combination of these symptoms can vary depending on the size and location of the fistula. Diagnosing a vesicorectal fistula requires a thorough evaluation. The process often begins with a detailed medical history and physical examination. Key diagnostic tests include a cystoscopy, where a small camera is inserted into the bladder to visualize the fistula directly. A colonoscopy can help identify any abnormalities in the rectum or colon. Imaging studies such as a CT scan or MRI of the pelvis are valuable for visualizing the fistula and surrounding tissues. A barium enema, where barium contrast is used to highlight the rectum and colon on X-rays, can also aid in diagnosis. A urine culture is essential to identify any infections. Dye tests, such as instilling dye into the bladder and observing its passage into the rectum, can confirm the presence of a fistula. While vesicorectal fistulas don't have strict classifications like some other conditions, they can be broadly categorized based on their cause. For instance, we can distinguish between fistulas caused by diverticulitis, those arising from cancer or radiation therapy, and those resulting from surgical complications. This distinction is important because the underlying cause often influences the choice of treatment strategy. Treatment for a vesicorectal fistula typically involves surgical repair. The goal is to close the abnormal connection between the bladder and rectum. The specific surgical approach depends on the size, location, and cause of the fistula, as well as the patient's overall health. Small fistulas may be repaired laparoscopically, using minimally invasive techniques. Larger or more complex fistulas may require open surgery. In some cases, a temporary diverting colostomy may be necessary to allow the tissues to heal properly. This involves creating an opening in the abdomen to divert stool away from the affected area. Antibiotics are used to treat any existing urinary tract infections and prevent further complications. Nutritional support is also important to promote healing. Preventing vesicorectal fistulas involves addressing the underlying risk factors. Managing diverticulitis effectively through diet and medication can reduce the risk of fistula formation. Regular screening for colorectal cancer and prompt treatment can also help. When undergoing pelvic radiation therapy, careful planning and techniques can minimize damage to surrounding tissues. During pelvic surgeries, meticulous surgical technique can prevent accidental injury to the bladder or rectum. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can promote overall bowel health and reduce the risk of complications. The prognosis for patients with vesicorectal fistulas depends on several factors, including the underlying cause, the size of the fistula, and the patient's overall health. With appropriate treatment, many patients can achieve complete resolution of the fistula and significant improvement in their quality of life. However, recurrence is possible, especially if the underlying cause is not adequately addressed. Recent research focuses on improving surgical techniques, exploring minimally invasive approaches, and developing better methods for preventing complications after radiation therapy. Studies are also investigating the potential role of biologic therapies in promoting tissue healing and reducing inflammation in patients with inflammatory bowel disease who are at risk of developing fistulas. Ongoing research continues to refine our understanding and improve the management of this challenging condition.